there was no consensus on wearing masks. And the president, as you know, relies on your expertise. Do you now regret not advising people more forcefully to wear masks earlier?
Okay, we're going to play that game. Let me explain to you what happened back then.
Should be a yes or a no.
No, there's more than a yes or no by the tone of your question. I don't regret that, because let me explain to you what happened. At that time, there was a paucity of equipment that our healthcare providers needed, who put themselves daily in harm's way of taking care of people who are ill. We did not want to divert masks and PPE away from them to be used by the people.
Okay,
now that we have enough, we recommend.
I've got two more questions, so thank you for that, Dr. Fauci. So, Dr. Redfield, I'm going to be directing this to you. Nursing homes, as we've talked about here earlier, make up nearly 90 or 40% of all the COVID deaths. And the CDC issued guidance on proper protocol for these facilities. Yet states like Michigan, New York, New Jersey, and California apparently disregarded that guidance. So, Dr. Redfield, do you think the decisions of these governors led to unnecessary deaths in these nursing homes?
Thank you for your question. I think the critical issue here is two things. One, our guidance is just that, guidance. Two, areas that we could impact the nursing homes, particularly in the infection control, working together with CMS very aggressively early on after the Seattle outbreak was recognized in that nursing home, really rechanneled energy into looking at the effectiveness of infection control in those nursing homes. Then restricted visitors to make sure.
Do you think that the decisions led to unnecessary deaths by allowing infected residents to come back into the nursing home?
I think, again, all of these decisions that have been made in the early days are subject to hindsight. We gave clear guidance on how people should be handled if they come into these nursing homes.
Okay, good. Now, the third question, back again to you, Dr. Redfield. We know in the foreseeable future that we're not going to have a zero risk of transmission. We're not going to get to that. So if we want our economy to recover, we know our schools have to reopen. So going back to the school question, in addition to tracing, distancing, wearing masks, what rate of infection is needed in your mindset for children to go back to school? What's the rate of infection? 1%?
Yeah, I'm not prepared to give you that definitive answer. I am prepared to say that one of the most important things we need to look at is not the number of infections, but the consequences of these infections. And there's two really big consequences. One is hospitalization and mortality, and the other is our economy, right? And I think we're clearly seeing that in many parts of our nation that one can open our economy safely, but it is going to require more vigilance than some of us see right now with the social distancing. We're going to continue to try to emphasize the importance of social distancing, face mask, and hand washing as we continue to do it. It's my expectations that many jurisdictions will be opening schools. We're going to try to give the guidance to help them do it safely. I think you're right, as Dr. Fauci outbreak in the jurisdiction at the time. I'm not prepared to give you that number, but I think we're going to see progressive jurisdictions move to open schools in the fall.
Yield back. My time's up.
We now go to Ms. Castor, the gentlewoman from Florida. I'd ask everybody to unmute before they begin.
Great. Thank you so much. Thank you to our witnesses today. When you compare the number of confirmed cases and the number of deaths in the United States with countries across the globe, it's really shocking, and it makes me angry and it makes me sad at the same time. We have 2.3 million confirmed cases. We have just over 120. And it appears that other countries have done a better job of controlling the spread. They've done a better job on testing and tracing. Every advantage that the United States of America has with our scientists, our public health experts, something has gone wrong here, and I think it starts at the top. I think the president's behavior and comments have undermined our public health professionals every step of the way. Dr. Redfield, I'd like to know, how often do you interact with the president and talk to him about public health guidelines and bringing all of your expertise to bear? How often do you interact with the president?
Well, I have regular interactions with as part of the White House task force as a member. Relates to my interactions directly with the president, and I'm going to keep those between myself and the president.
Well, you know, every time the president contradicts scientists, every time he contradicts our public health experts, whether it's the wearing of masks or mass gatherings or drinking bleach or taking hydrochloroquine, it costs lives. And I agree with my colleagues that we really expect you to be more outspoken when it comes to these public health advisories. It will cost lives. It has cost lives. And but I'll change direction now for Dr. Fauci. You know, Floridians are very concerned with the latest spike in cases. The Florida Department of Health announced just a little while ago we've got another 3,300 cases and 64 deaths just since what was announced yesterday. 25% of the total cases in Florida have been confirmed in just the past 10 days. And we have a positivity rate of now up to 13% in the past week. So what message do you have for the state of Florida and other hotspots across the country as we have so many more young people who feel invincible that are testing positive and our economy is opened up? What is your advice to Floridians and others in hotspots?
You know, my advice to the Floridians is the advice I would give to anyone and everyone, to follow the guidelines that we have very carefully thought out and put out in how one can reopen or open America again. And that is to stay within the framework of the particular phase of reopening you're in. The comment I made a little while ago about the confusion there must be, particularly among young people who have a pent-up urge to go out, which is understandable. But what they need to appreciate is that they are part of a process of the dynamics of an outbreak. And although they themselves may perceive that they're at very low risk for something that would be deleterious to them, by propagating the process of the outbreak, they may be indirectly hurting people by infecting someone who then infects someone who then infects someone who's vulnerable. So they need to understand that. If we could get that message across, that it's not an all or none phenomenon. Getting back to normality is going to be a gradual, step-by-step process, and not throwing caution to the wind.
What about